This is where the academic meets the other elite. Thought-provoking dialogue, conversations that change direction. The Intellectual Thug Podcast, knowledge in motion, purpose and sound. This is the Intellectual Thug Podcast.
Hey now, everybody. I want you to know we're happy that you came into this space today to be with the Intellectual Thug. I'm your host, Lady Pamela, and I have a panel of guests. But what I want you to know about the Intellectual Thug, we want you to come and be 10 toes. Did you hear me? 10 toes down, ears up. And this is where growth is non-negotiable. You're not going to negotiate your growth because you will grow behind this. And integrity is currency. Gather with us as we talk and chop it up and elevate a conversation to a level with health and wellness. And today's topic is about ovarian cancer. Our esteemed guest presenter today is Dr. Christine Kimball. Dr. Kimball. And next to Dr. Kimball, in the middle, we have our wonderful Rita Banks, who is going to share with you her personal testimony and truth to power. Come on, get at it today. 10 toes down about what it means and her experience that was lived with cancer, ovarian cancer, and cervical cancer. I'm sorry, hers was cervical. But cancer is cancer. We're here to stamp it out. Mm-hmm. And Saban Lewis is one of our presenters today to bring in her personal experience of what it was like to have a doctor at a young age tell her, you don't need to have any more children. Let's do a hysterectomy. She'll tell you, come on. I'm your intellectual thug. Now, I ain't going to get all into it. That's why we got our guest here today. So let's start with bringing it all front and center right now today with Dr. Christine Kimball. Tell us just in a few words a little bit about your background, because she is with the Ohio State University.
Yes, I am with the College of Nursing, and I do have to state that the views and opinions expressed here are strictly my own and do not reflect the official position, policy, or endorsement of the Ohio State University. My participation in this wonderful podcast is in my individual capacity and is not representative of the university or its leadership. So my background really started when I was a burn nurse. I would see patients come in and sometimes their, sudden injury was too severe to do surgery. And I saw the families, the patients, the doctors, even the nurses really struggle to have those difficult conversations about what to do next, whether or not to do comfort care, to bring palliative care in. I saw that people didn't have a plan. Mm-hmm. So that was really my drive for doing research, to really help people have those difficult conversations. And I think it's so perfect to talk about ovarian cancer, because even if we don't have cancer, we're not aware of our risk, it's really important for us to, as a family, be able to talk about health and be able to talk about our experiences in healthcare. So I'm so excited to be here today and to hear the powerful stories of, we're all women here and we've all experienced good things about healthcare, but we've also seen how healthcare can sometimes let us down. Mm-hmm. So I'm really excited to hear your stories, and I'm really here to listen and learn from you, as well as provide some of the up-to-date guidelines on ovarian cancer as well.
So that is such a wonderful intro, and thank you for the disclaimer. Yes. And that disclaimer echoes clear over to me, your host, Lady Pamela, as your intellectual thug. We're presenting voices and perspectives. No indictments. We're not accusing anybody. We're just trying to flow with the flow and give you some information and tell you come in this space and be 10 toes down. Come on, somebody.
That's right.
And get your ears up and hear something.
Yeah.
And I just want to add as a footnote, if you conclude at some point throughout the podcast that we're talking something you don't believe in and you think is trash, be reminded, today is not the day to take the trash out. Stick around and listen. So, Dr. Christine, give us some of the data that ties into ovarian cancer. We already know that it is the silent killer.
It is, absolutely. So, and I again want to disclose that a lot of my work isn't necessarily in any one type
Correct.
of disease, which allows me to learn more and more about different conditions and how something called shared decision making, where it's really in contrast with historically where the decisions were made by the doctor and not by the patient. So really it's about making those decisions together, making sure that any treatment decisions are made with the patient's goals, the family's goals in mind, so that it's centered on the patient. So in terms of ovarian cancer, it is the 8th leading cancer and cause of cancer death for women.
I want you to say that again because somebody came in this space and they didn't put 10 toes down. I want you to put all them toes down and get 2 ears up.
Okay.
Say it again, Dr. Christine. It's what?
It is the 8th most common cause
Come
of
on
cancer
now.
and cancer death in women.
Wow.
Unfortunately, most times it is caught in the late stages of cancer,
That's
either
correct.
stage 3 or stage 4. Unfortunately, there is no reliable way to screen for it because typically women will come in with abdominal pain, they'll come in with urinary tract infection symptoms like urgency. We've all experienced UTI
absolutely.
before. But so if you're coming into your doctor, they're probably going to say, oh, you probably have a UTI and give you antibiotics. So it's unfortunately something that can go without really being detected.
So, Dr. Christine, just so that our listeners, because you know we're targeting the academic elite scholars, and along that same trajectory, I'm looking for the possibly revolutionary scholars that want to be out here and help change the landscape of health and wellness. So tell us what a UTI is again. Just give us the full name of what a UTI, because men and women can get them. Don't play today.
That's true. It is more urinary tract infection.
There it is.
Yes, it is more common for women because we have a shorter pathway.
That is correct.
For the bacteria to go. Typically, the urethra is not a space where there is bacteria, but our skin and the areas around our skin have good bacteria it that can sometimes travel up into that area. So for a woman coming in, it's not uncommon for them to be complaining of feeling urgency, pain with urination, and then to get diagnosed with a urinary tract infection. Typically they have to, take some urine and test it and confirm that there is bacteria in there before they give you antibiotics. But that's what makes ovarian cancer difficult to detect. And they typically say there are some ways that they test. They do a blood test for let me look at that. Sorry, again.
No, do your notes.
I'm going to rely on my notes.
Absolutely.
It's called CA-125 blood test, and it's a level of a cancer antigen, a protein that is often increased in ovarian cancer cells. But unfortunately, it can also be increased when someone is on their period, or if they have pelvic inflammatory disease or endometriosis. So that is why women really need to have symptoms before they're going to test for it. We can also talk about some of the risk factors as well, but I also don't want to dominate. And wanna
Okay, but
give-
you know, that's a good segue.
Yes,
and I'm
absolutely.
thankful that you said just what our next guest is going to talk about, and that's Rita Banks, who is going to talk about her lived experience. Now, come on, get in this space and be 10 toes down. You're with the Intellectual Thug Podcast. This is the Positive Thug Nation. Come on, somebody. She's going to talk about her lived experience with having cervical cancer.
Yes.
So tell us, Sister Rita.
Woke up first Sunday, June 2022, getting ready to go to church. I sit on the toilet and I start hemorrhaging. I'm like, So I clean myself up,
Yes.
drive myself up to Riverside, and wait to be seen. I go in and this lady is probing,
Sure.
and I could tell by her expression something is wrong. So I asked her, she said, well, I'm not a doctor. You have to wait to see a doctor. I go back to the room. Doctor comes in. I'm looking at something on television. I don't know. Got my hands behind my head. So he says, did anybody come in and talk to you? I said, no. Aren't you the doctor? He said, yeah. He said, well, you have stage 4 cervical cancer. So I guess I didn't give the response that a normal person would. So he asked me, did you hear what I said? I said, yeah. You told me I have stage 4 cervical cancer. Now, I took what he told me as power.
Yes.
I have.
Yeah.
Come on
I
now.
have cancer. Cancer doesn't have me.
Yes.
Come on, say that.
It never resonated or spoke into my soul. Death. I just said, well, if you're coming for me, you got a battle on your hands. I ain't
That's
going
good.
down easy.
That's good.
I went home, told my family, and that was June. August 2nd, I had surgery. My doctor told me, she said, you'll either have to have chemo and radiation. She said, that's what it looks like now.
But your surgery was a total hysterectomy?
Yes.
Okay, that's what
Yes.
we want to make sure
At
that
what,
our nation is
60-some
hearing.
years old.
Uh-huh. That's what they need to hear.
And I went through that well. And then my doctor explained to me, she said, well, when we got in, it wasn't as bad as we thought it was.
Isn't that amazing?
And I told her, I said, probably all that fat.
I get it, though. I get it.
I brought all that fat, bluff.
I get it.
So
We keep it real here
Right.
in the Intellectual Thug Nation. These are positive.
I ended up having, I didn't have to have chemo.
Okay.
But I ended up having to have 7 bouts of radiation therapy.
Yes, okay.
And I drove myself there and back, and it was just like, I wasn't fearful.
Sure,
I was never afraid.
sure.
I never felt like I was gonna die.
Sure.
I just felt power
That's good.
in me. Be afraid of me, not me afraid of cancer.
Oh, now, come on,
Uh,
somebody that need to show up in this space and be 10 toes down, ears up, because this is the Intellectual Thug Podcast where we're bringing it to you.
I never told my
Wow.
siblings.
Mm-hmm.
And when I did, I told my oldest brother, I said, he just looked at me kind of funny, like, everybody look at you like, oh, she's going somewhere. So all I'm going to do is get in my car and go back to Ohio.
That's right. That's right.
I ain't
That's
going
right.
to, I'm not exiting yet. I didn't
That's
feel
right.
that.
It was not a death
It wasn't your time.
sentence.
I
Not
didn't
your
feel
time. I
that.
love that. I love that.
I kept hearing a little voice. It was so
Come on.
light, and it whispered, you're going to be just fine.
Yes.
You're going to be just fine.
And what did you believe that voice was from?
The Creator.
Come on, God.
That's what I
Come
believe.
on. Come in this space and
That's
be
what I
10 toes
believe.
down,
I mean,
ears
from
up.
the very beginning, like I said, I'm no superwoman. I'm just flesh and blood like anybody else, but
That's good.
I just didn't feel no fear. I had a younger sister that succumbed to cancer. My mother succumbed to cancer.
Yes.
But that's my sister. That's my mother. I'm me.
Well, you have a
Amen.
strong lived experience, and I thank you so much for being so transparent and authentic and sharing, because a lot of people wouldn't tell it.
Yeah.
And thank you for coming in this space, being 10 toes down and getting it in.
Yes.
Now, Siobhan,
Yes, ma'am.
your encounter was something a little different than that. Share with us what you went through.
Fortunately, I was not diagnosed with cancer. Praise God.
Speak up just a little bit more.
My journey was over about a course of 20 years. Because the moment that I got my menstrual cycle, it was never regular. It was always either missing in action or it was a whole lot.
Delayed.
A whole lot for a long time. So I actually got put on birth control not to prevent pregnancy, but to regulate my cycle.
Correct.
My experiences with going to doctors was not good. I ended up going to the same gynecologist my mother went to. That was a very bad, the patient information that I was told. I'm 18 years old. This is my first time ever exposing myself, and you're talking to me like I'm nothing. And I have a problem and I have an issue. So that was at 18. By the time I was, I got an ovarian cyst when I was probably about in my 30s. And I got the message, we're going to wait and see.
Yes.
And I kept asking, what does that mean?
Yes.
Wait and see. And I made preparations. When I went to work, I had 2 bags. I had a bag in my bottom drawer if I needed to change my clothes. And I had a bag I needed to go to the bathroom with.
Sure.
I would tell my coworkers, if you get a text, bring me the pink bag.
That's right.
That's the only way I'm
Your
going to be able to
health.
stay
Come on
here.
now.
But then later on, when I was 37, I didn't know I was in pain. I was on a trip with my mom, and I'm driving, and she says, Siobhan, why do you keep
Making
and
sounds.
I didn't realize I was doing it, and I said, I have some cramping, and I went to the doctor. This is over a course of 19 years.
Sure.
So when I go back to the doctor after having the ovarian cyst removed, I was doing a lot better, but it never stopped. My cycles never stopped.
Yes.
They got worse and worse. So later I find out that I have uterine fibroids with
Yes.
NETs. And I was asking for a hysterectomy by this time. I had no children. I was still young. My first doctor in Cleveland Clinic, renowned doctor, a top surgeon, she called me at work. She refused to give me the surgery. She said it will shorten your lifespan. I cried while I was at work because I'm in pain.
Yes.
I don't have a quality of life. It's happening so many days of the month that there's no days that I really get off day.
Sure.
So then when I came to Columbus, again, I went to another doctor, and the surgeon, he said, no, I'm not doing it. And so I finally got so frustrated, and I was mad, and I was angry, and I was depressed, and I was anxious.
Come on.
I said, why?
Yes.
He said, I'm retiring. I said, what that got to do with me? Is there anybody else in here that can do a surgery?
Yes.
That's how I got my hysterectomy. The moment I woke up, I felt less pain and pressure than I had in the past 5 years.
Wow, that's amazing.
So I hope to share with people that you have to advocate for yourself.
Absolutely so. And you did a wonderful job exposing the integral parts of your experience and the timeline that went into that. Because, Dr. Christine, can you just touch on how important it is to do regular checkups, go to the doctor, get these things done? But as Siobhan just said, be an advocate. Speak up. That's why we're telling you, being in this space today, listening to what we're talking about, we need you to come in and be 10 toes down, ears up, hear what's being said, because you hold the power, as Rita Banks has already said. You hold that power. But if you don't advocate, talk to us a little bit about the importance of advocating for your health, and then how that is often embedded into trauma and pain.
I think it's really hard to be on the patient side of things. You know, they put you in a gown.
Yes.
And I think as well, it's so hard to be a woman in that setting as well.
Sure. Sure.
So much of what we feel we have control over feels as it's stripped away in those moments. And it's very hard. But knowledge is power.
Yes.
Knowing your risk, knowing if you have a family history,
Yes.
starting with that.
She did. Rita Banks did a good job with that.
Yes, did a wonderful job of that. And you know your experience and your history better than anyone.
That's right.
You are the expert on your own life. So that doctor may be with you your entire life, they may not, but if you're saying, look, I have a sister, I have a mother
That is
who
correct.
have cancer, I need to know what my risk is, I need you to listen to me. I have had pain for my entire life as a woman.
Yes.
I need you to listen to me. I need you to take me seriously.
Yes.
And that is exactly what both of you have done.
That's
and that is
amazing.
amazing. So I know you said that our goal is to share information.
Yes.
As I was going and preparing for our talk today,
Yes. Please.
I wanted a takeaway. So there are 3 A's
Okay.
that I want people to take away.
Okay.
Awareness,
Awareness. Got it.
assessment,
Assessment
and advocacy.
and advocacy.
So
That's good, Dr. Christine.
thank you. Awareness I got from our talk, so I have
Yes.
to give you full credit, Ms.
Yes.
Pam, our intellectual thug.
Yes.
So a couple of the risk factors, the biggest one that we can actually do something about is our genetics. So
Ooh.
have y'all ever heard of the BRCA1, BRCA2?
Yes.
That's linked with breast cancer
Yes,
and gynecological
absolutely.
cancers. So it accounts for about 25% of cases of ovarian cancer. So
That's good, Doc.
so typically what they do is it is something that you can talk to your doctor about. If you have a strong family history, they will
Yes.
do a assessment with you. So they'll ask you about your family history, about your siblings, about your parents.
That's great.
And all of that. And then they will help guide you as to whether or not you're a candidate for genetic counseling and testing.
Yes.
So those are important things just to keep in mind. You don't necessarily have to remember, BRCA1, BRCA2 mutations.
Got it. Yes.
But it's important to know.
And again, Dr. Christine, this platform in the Positive Thug Nation is to make people aware.
Absolutely.
And all we're trying to do is say, this is a gentle nudge. We're trying to nudge you to
Absolutely.
think about these things, address these issues. Now let's be proactive. Take this
Yes.
information back to your hood, I'm talking about your neighborhood, not Mr. Rogers. Don't go to his neighborhood, go to your neighborhood. Share this information and let everybody know what needs to be done. That is so amazing. So, Miss Rita, what is one thing you want the audience to know?
Faith
Ooh,
over fear.
Yes.
that's good. That's
real
good.
Faith.
And why would you say faith over fear?
Well, if you don't have faith,
Come on.
you have nothing.
Come on.
You gotta have faith.
Come on. I love that.
That has been with me since childhood.
Love that. Love that.
Faith.
Savon, your turn. Tell me what is one thing you want the Positive Thug Nation to hear from you. One thing.
I would say to be persistent.
Ooh,
for
I
you-
love that.
For you. Because, like Dr. Christine said, you know yourself better than anyone else.
That's right. That's right. And keep at it. So, you know, I've had this concept, the intellectual thug, on my radar for several years because I felt it was so important that Dr. Sigmund Freud said it best when he said the voice of an intellect is a soft one. I was really, really, really impressed by that. And then he went on to say that it doesn't rest until it gains a hearing. And that's what that persistence means. And when I was in school working on my PhD, and my professor, you know how you have to have these papers, Dr. Christine, you know, whoa, my golly, you write your papers, you have to have your scholarly voice, and they have to hear that voice in your writing. That's how it is.
Yes.
When I got my paper back, it was so much red on the paper, I said, Lord have mercy. I didn't even stand a chance, but I wrote the quote by Dr. Sigmund Freud that said the voice of an intellect is a soft one and it doesn't rest until it gains a hearing. And my professor responded by saying, I never heard that before, and that helped to change your grade. Come on now. Come on, because I'm not going to stop. You can mark it up all the red you want to. I'm going to fix it according to your grammatical request. But the voice that I have,
Yes.
I ain't giving it up. I ain't giving it up. And that's what you did for our Positive Thug Nation today. You gave them what they need to be hearing, that you got to be persistent. You got to have faith over fear. You can't mess around with it. And Dr. Christine, you got to ask questions. You need to say, what's the research? Now there's no excuse. We can Google everything. And what's so amazing, while you're sitting in your doctor's office, when they say, you have this, your blood work came back as this, you can be Googling it right then and there. Take your own life. Isn't that what you said, Miss Rita? Say it again.
Yeah.
Take what? Take your own life in your own hands. It don't have you. Say that. Go through that one more
Yep.
time.
I said cancer got me. I got cancer.
Come on, come on.
That's what the doctor told me.
And you
that
gonna
was
change.
so
That's
powerful.
the power. That's the
That
power.
was so powerful.
That's the power. Because you use that power to change your life.
Yeah.
And you have, when is the next time you will go and see your oncologist?
May.
Wow.
May,
And you've been, this
It
diagnosis.
happened in 2022.
That's what I want you to do, the historical
2022.
timeline with
So
us.
I'm like 4 years out.
Isn't that amazing?
Yes.
Now then, that Positive Third Nation, y'all need to be giving up some claps on that because she's living proof
Yes.
that you can go forth, be strong, use the power that you have over your body, your diagnosis. And Dr. Christine, tell us one other thing besides your three. Review the 3 A's again: awareness, and then tell us.
Awareness, assessment, and advocacy.
And tell us again why that's so important.
I think most people who are working in healthcare
Yes.
are I think they have good intentions, but I think they're I think they're busy. So sometimes you have to advocate for yourself. You have to be the one who is laying down the facts and telling them, I know what's going on. I need you to hear me.
So this has been an amazing panel today. And you know, one of my signature comments is to close out today's session, the intellectual thug, with the benediction. Come on, somebody. I need somebody that will believe in what I'm saying. We're going to have a benediction. And Sister Rita Banks, who is also a poet, she's going to give you a snippet of one of her poems. Share that poem with them. Come on, we're running out of time. You got to come on real quick.
I just went blank.
She just went blank.
I just went blank.
That's
I went
okay.
blank.
But with this topic was so amazing, and I feel like we're going to have to do a dissection and cut it in half, and we may be back. Thank you.
Yes.
Stay tuned. We'll be back. Again, the intellectual thug, voices and perspectives, 10 toes down, ears up.
The intellectual thug podcast.